So I'm Dr. Ronald Van Tuyl. I am an otolaryngologist. I am ear, nose, throat, and allergy specialist. I've been here since 1994. I'm board certified in ENT and allergy, so I'm double boarded. I would like to discuss the symptoms of sinusitis and treatment specifically for sinusitis when it's chronic and not improved with medications. A patient is a candidate for balloon sinuplasty if they have failed medical management, and that usually includes 4 weeks of continuous antibiotics, topical nasal steroid sprays, and nasal saline lavages. They're usually the patient who has been on antibiotics over and over again without improvement of their symptoms. The workup for balloon sinuplasty includes antibiotics, and we usually use a broad spectrum antibiotic for 4 weeks total, and that can be given by your primary care also, but we will continue that if need be. But usually 4 weeks of continuous antibiotics with topical nasal steroid sprays. In addition, we will also do allergy testing if needed, if you have seasonal or perennial symptoms of allergy, and also possibly a CT scan to examine the anatomy of the sinuses to determine where the blockage is inside of the sinuses. So the workup includes a long process of antibiotics, nasal steroid sprays, and saline lavages. So balloon sinuplasty is an in-office procedure that we do to treat chronic sinusitis. And those are the people that have failed medical management and continue to have symptoms despite appropriate medications. The in-office procedure is a procedure that we do under local anesthesia. We also supplement that with nitrous oxide. Patients are very relaxed, and we use a device to dilate the opening of the sinuses to relieve the obstruction and cure the chronic infection. So the device is a balloon which was developed by a cardiologist, which is introduced under local anesthesia very comfortably. We sedate the patients. We make sure that you're very comfortable. You're listening to your favorite music. But we introduce the balloon into the sinus ostium, which is the drainage area of the sinuses. And we dilate that to about 3 times the normal size. And we do that on all involved sinuses. And so that improves the drainage and the ventilation of the sinuses to resolve the chronic infection. The procedure of balloon sinuplasty takes about an hour. We schedule the patients. They are pre-medicated with Valium. We start nitrous oxide in the office. We do topical lidocaine to numb up the inside of the nose. And then we have a 1-hour recovery period where we watch the patients afterwards to make sure there's no blood pressure problems, there's no bleeding. We go over post-operative instructions. So the post-op recovery period after balloon sinuplasty is roughly 1 week. Usually you can return the next day to work. There is a little bit of drainage, discolored drainage, for a day or 2 afterwards. Usually pain medications are only over-the-counter Tylenol and ibuprofen. We do saline irrigations twice a day for a week post-operatively. And if need be, we treat patients with allergy medications. If there's pre-existing allergies, the surgery doesn't cure the allergy problem. The surgery cures the chronic infection. So if allergies are present, we will keep them on topical nasal steroid sprays, antihistamines, and if need be, if that's not enough, then we do allergy shots here in the office. How well the balloon sinuplasty procedure works has been studied. And so there were patients who were done with traditional in-hospital surgery and then in-office balloon sinuplasty. They were followed for 2 years, and they both did the same, 85% improvement in symptoms. But I think it's important to note that the balloon sinuplasty resolves the chronic infection, and if there are underlying allergies, complete recovery takes treatment of allergies as well. But overall, 85% improvement in chronic sinus symptoms. If you feel as if you have sinus problems that aren't getting better, and you're constantly on antibiotics, we would love to see you as a patient at ear, nose, and throat specialist in Canton, Jasper, or Blue Ridge.